Tell me about the palm of the hand. When somebody, I'm hurting here, what do you think of?
So most common things, obviously trigger finger, and people say, well, what's a trigger finger?
What's a trigger finger?
So mostly tendonitis.
What's a tendon?
Tendon, oh, great. So a tendon, muscle in the forearm, attaches to a tendon like a rope, pulls the pulleys.
Yeah.
So there you go, you clasp your hand. The tendons in the palm run through a series of tunnels called pulleys. So as you grip, oftentimes heavy gripping can create some swelling. So the tendon and the pulley then rub, create more swelling. So that's the most common thing we'll see.
Where does it usually occur? Where is that?
The thumb's
irritation?
the most common.
The thumb is the most common.
I don't know. There's something about East Tennessee, long fingers. Maybe I had it too. But the long finger is what I think is most common. But if you look in a doctor book, the thumb. And it's pretty uncomfortable having had it myself. It'll feel like someone is basically squeezing around the knuckle itself. But
can you use your cell phone with that?
You can use your cell phone, yeah. And most people will be able to use their hands without bending their fingers.
Can you shake hands with somebody with a sore thumb?
You can, yes. But that's probably the most common thing, and the easiest thing for it is a cortisone injection. The most recent literature will state that the first injection, probably better than 90% success rate for a lifetime cure. Even if you had it a second time, it's greater than a 72% lifetime cure. So
a cortisone injection, does it hurt? You stick a needle in the finger?
So I'm not a big fan of medicine or needles. I'll be the first to say that, or pain. But if mine came back, I'd take one for trigger finger. Now in other things, say most common painful arthritis in the body is the thumb joint right here. So 25% of people in the world have arthritis right here in the thumb joint that causes pain. More common than knees and hips.
So with the cortisone injection, how long before it starts to feel like Superman's thumb again?
You can get a shot for the arthritis just at the base of the thumb here. You won't like me the next day, I'll be honest with that, but the steroid takes a good 36, 48 hours to kick in. We can put some ice on that, you can wear a brace, but generally after about 48 hours, it starts that steroid medicine after the numbing medicine wears off. The steroid medicine will start to kick in and get the inflammation down, and that's arthritis. I mean, arth is the word for joint, itis, inflammation. It's just a garbage term for inflammation or pain in the joint. Put a little love in there, a little medicine, and that steroid is actually what makes that inflammation subside, and it lets you start to move the joint easier.
So I've seen some patients that have had that, and they said, oh, I only wished I'd have gone to Dr. Renfree sooner, because they do get such good results with that.